Similar to the neck self-mobilizations that I show my patients with neck pain, I'll often show my patients with low back pain how to perform low back self-mobilizations. This self-mobilization can easily be performed without any type of outside device or assistance, but I do generally recommend the use of a dowel rod if you can get it to increase the amount of mobilization that you're going to achieve. So the benefits of this maneuver, just like the cervical one, is that you can perform it at home on your own time and pretty much as regularly as you want to. Again, self-mobilization is easy to perform and works similar to how an adjustment works. The idea behind both of them are the same. When you manipulate a joint, you're trying to get it moving better and loosen up the area around the joint. The same is true with mobilization. So the same thing happens here, it's just that you can do it on your own. To perform this maneuver, what you got to do is you got to find yourself a surface to lay on, hopefully where you can lay on the edge of the surface. A bed's usually your best bet, but a couch also works. So I'm going to show you how to mobilize the left side of my low back. So what you're going to do is you're going to lay on your right side with your left side up. You're going to bend that left knee and keep the right leg nice and straight. And what you're going to do, if you don't have a dowel rod, you're just going to place your right hand on top of your knee and your left hand on your low back where you're feeling particularly tight. And what you do is you let that knee hang off the side of the edge of whatever the surface is that you're on, and you push down on your knee and push forward on your back. And what you're doing is you're pushing until you feel a nice stretch, and then you're holding that position. Generally, I recommend holding it for about 30 seconds, and then you're letting go. And here's the part where a dowel really helps out. If you do have a dowel, take the dowel and put it under in the crevice and then under the bottom leg. And then what you're going to do is you're going to pressure down on the dowel rather than on your leg, while still putting the pressure on your low back. And now you go into that mobilized position, you're pushing down, and then you relax. And now when you get to this relaxed position, what I have people do is I have them push up, but at the same time, they're not moving, they're just pushing up against their hand. And so then you push up for about 10 seconds, and then you go back down for another 30 seconds. And what this does is it helps you get a slightly better stretch than you otherwise would if you didn't have the dowel rod. So again, with this exercise, you want to make sure that you're doing it appropriately. You don't want to go too far into rotation. If you have sharp radiating or pain that is really abnormal, then you need to stop. It's generally best to talk with a doctor before performing these maneuvers, but for the most part, they are safe to perform at home. So I hope you found this helpful, and I hope that you take care of yourself, keep your low back nice and mobile.